Hi, I'm Dr. Shamieh. On this week's discussions, I want to talk about commonly asked questions in the clinic. Every single patient will come in and say, how long did it take you to finish your training? Well, there's 4 years of medical schooling, and then there's a 5-year orthopedic surgery residency. If you're a neurosurgeon, then you go through about 6 or 7 years of residency. In those years, you're an intern, which is your first year of residency, and then you go through the rest of your residency. I did a special 1 year of nothing but minimally invasive spine surgery called a fellowship, where I trained with a neurosurgeon and with an orthopedic surgeon to learn the best of both worlds. During that training, we don't just automatically start operating on people. You have to go through certain levels of training. And when the attending physician or the teacher deems you ready to step on to that next level, then we start increasing our responsibilities. Once I finished residency and went off to fellowship, there was a special test that my fellowship director made me pass before I started operating on the spine. And that special test was drilling the shell of an egg away from its membrane on the inside without breaking that membrane. So the shell is like the bone of the spine, and the membrane is like a nerve. So you don't want to damage the nerve underneath. You want to just take away the bone so that you can clear away anything pushing on the nerve. And you may ask, well, how do you do that? In a previous video showing the tools and instruments that we use in minimally invasive surgery, I showed you the tube that we look through. This is an 18-millimeter tube. It attaches to an arm that stays still, and then we use the microscope to look down the tube, and we place instruments down this tube and use it to operate on the spine. So a lot of people will ask me, well, doc, do you have a steady hand? Let's find out. You can see that the tip of the drill is safe. So even while the drill is going, it's not going to break my skin. So, ready to get started? Let's see if I can do this without getting egg on the face. As you can see, I've taken away all the shell in a circle around the top of the egg and separated the shell from the membrane. You can see that the shell in the middle is completely movable. So if your doctor tells you that you need spine surgery, ask him, can you take the eggshell off of the egg without damaging the membrane? And remember, if you can dodge an egg, you can dodge a complication.
If you can dodge a wrench, you can dodge a ball.
What?
Any other questions?